Let's talk about vices, specifically drugs. So, marijuana and beer, both extremely popular. Of course, marijuana is becoming more popular these days. But as we know, these drugs don't necessarily help you. They may be a release, they may be a way to party and have fun, they may be relaxing, but they're not going to help you perform at your fullest, to perform at 100 or 110%. Both of them can potentially lead to hangovers. They can lead to worsened sleep. So consider reducing or eliminating these drugs in the final weeks before test day. Now, I will say, however, that although I recommend against marijuana, some students have found benefits by using CBD oil, which is, I believe, pronounced cannabinol, which is one of the active ingredients in marijuana. It does not get you high, which is the reason it is legal everywhere, or at least legal most places, and it's non-psychoactive, but it does tend to have a relaxant effect. Another herb that can help to reduce stress is known as ashwagandha. That's also something to consider. So not all drugs are necessarily vices, even though that's what I titled this lesson. I do also want to recommend, however, that you minimize coffee and cigarettes if you use either one. Of course, do whatever you normally do. If you normally have those in the morning, don't try to go cold turkey now, or you'll almost certainly find yourself with a pounding headache. However, do keep in mind that coffee is a diuretic, so it is likely to make you go to the bathroom. If you normally smoke a lot, you might consider nicotine gum instead. I would only recommend taking Adderall if you've been prescribed it and if you have used it before on practice tests and found that it went well. I got one question from a student related to coffee. Has any student discussed with you about bathroom jitters, such as nerves creating the urge to go? Maybe the coffee or water is just doing their thing. I don't even know how to best ask such a question. Now, this student asked the question fine. I get what the student means. Of course, nerves can make you go to the bathroom, and that certainly happened to me at times. Coffee is a diuretic, so it's better to minimize it if possible. But don't go too far below your norm, though. You also want to reduce water, but have what you need. Bathroom jitters are really just a symptom of a root cause, which is anxiety. This is totally normal. If you can reduce your anxiety, you can reduce your bathroom jitters. So we come back to one of the earlier mental hacks I've talked about before, which is to ask yourself, what happens 3 to 5 years from now if everything goes great? And what happens 3 to 5 years from now if this test administration does not go well? By fleshing out these two possibilities once again, you make them more real for yourself because you reduce the ambiguity of what that unknown negative outcome actually looks like. And as a result, you'll hopefully feel better about whatever may happen. So always ask yourself, what's the worst that can happen? And accept that whatever happens, you do have options. Maybe you'll try again, and you'll keep trying until you achieve what you want. Hard work pays off, sometimes slowly. And a lot of the time, although drugs can be appealing, they're not really the way to get there. The ability rests within yourself and the prep that you've done up to this point.